right, guys, so now I'm going to talk about spit up. This is also a really common question and something that I think is really good to know about your baby. So with spitting up, it is a normal thing that a lot of babies do. And it is normal because for your baby, they have a little valve to their stomach and it is just very loose in a newborn. Very common along with other things that you notice in baby, like you might notice, oh, their shoulders pop a lot, their knees pop when I'm just moving them, and that is okay. These are normal things. Babies are meant to be very bendy and kind of move easily because they're made to come out of the birth canal. So that is normal in your baby, but sometimes it can cause some concern with spit up. So what is normal and what is not? So I would say about 80% of babies do just have this normal spit up that we notice. Most parents, I feel like, don't mention it until we're noticing babies taking, more volume of breast milk or formula. But it is a common thing that we see. If you notice the spit up is happening and it's white, it's sometimes a little bit curdled, that would be normal. Things that we would look for that would be concerning for spit up would be any spit up that is bright green or bright yellow. That would be concerning for an obstruction. And so we would definitely want to know about that. The other thing that we would worry about would be spit up that is persistently projectile. Most parents will have an experience at some point of their baby having a spit up that they would describe as forceful or projectile. Usually it will come with the story of, oh, baby was really hungry and we were feeding really frequently and having a lot of cluster feeds. And then all of a sudden they just threw up and it was just all over me. So this does happen very frequently. Most parents will experience this at least once. But if this is happening very consistently and with every single feed and getting worse with time, especially when baby is in that 3-week to about 8-week period, that's something that we would want you to talk with your doctor about because that could be a sign of something else going on. If your baby is around 1 month of age and you notice the spit up getting worse and they're having pain with feeds, so you're feeding them and then you notice, oh, all of a sudden they seem to be kind of arching their back with feeds, they're just really fussy, not comfortable, kind of seem stiff. That can be a sign of acid reflux, so that's something else that you would want to talk to your doctor about with that.